Good morning friends, welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Please don't forget to subscribe to my channel and also please give your valuable comments. You can also visit the playlist. In the playlist I have provided almost all the topics in a very systematic order. I hope this will be very convenient for the continuous study. My dear friends, in the last class we have been discussing about general examination. In the general examination, body type, then posture, then nutrition. So these are some of the points which you have already covered. So today we will cover one more very important point in the general examination during the clinical examination. So that is posture of the child. Posture. Okay, posture of the patient or posture of the child. Now, what do you mean by posture of the child? Posture means the position or attitude which is constantly assumed by the patient when he is in a rest or in motion. That is called as posture. That means when the patient is sitting, when the patient is moving, or when the patient is in the bed sleeping, what is the normal position attained by his body? How he is keeping his limbs, how he is keeping his legs, how he is keeping his neck, okay? And what about the position of the vertebral column? So this actually indicates the posture. That is, it is a position or attitude which is constantly assumed by the patient when he is in rest or in motion. So rightly, depending upon this, we have got different types of posture. For example, sitting of posture. Sitting of posture means the posture attained by the patient during the sitting position. So when sitting, how he is sitting actually, whether one side is drooped down, okay, so whether it is hyperextended, whether it is hypo extended, like that. So sitting of posture. So whether he is sitting in the erect position or he is bending to one side like scoliosis or kyphosis, like that. So sitting up posture. So sitting up posture is also called as posture at rest, and it is also called as posture at static condition or static posture. Similarly, the posture attained by the patient in the bed. So when he is sleeping in the bed normally, so what is the posture attained? So this is also called as decubitus. So decubitus is nothing but posture attained by the person or child or patient when he is sleeping in the bed. In the bed, what is the position of the patient? So that is called as decubitus. One more position is a posture is a upright posture or erect posture. Okay. So this is also called as standing posture. So when standing, whether he is standing in erect posture or whether it is sideward bending is there, or whether the curvatures of the vertebral column, anterior curvatures and posterior curvature, whether they are hypo exaggerated or hyper exaggerated, etc. So that we will see in the upright posture. One more is dynamic posture. So dynamic posture means this is a posture of the body during the motion. When he is moving, what is the posture of the patient? So that is referred as dynamic posture. So when you are looking at the patient in general examination to see the posture, these are the different points that you should know. Okay, first of all, you should know the difference between posture and the decubitus, and how many types of the postures are there and how many types of the decubitus are there, and what is the clinical relevance. Now, posture of the patient is not a simple mechanism. Posture depends upon many of the factors. A person is maintaining the normal posture means its neuromuscular mechanism is normal, because maintenance of the posture is also neurological. Maintenance of the posture is also muscular. If there is a coordination between this neurological and muscular systems, then the normal posture of the patient will be maintained. In some of the neurological problems, because of the weakness of the muscles, because of the improper neurological stimulation, nervous stimulation, the muscle may not be able to maintain the proper position. It may be either hypertonic or maybe hypotonic. So neuromuscular mechanisms are very important, number one, to maintain the normal posture. So if the patient is having some posture problem, first look at some of the neuromuscular problems. Okay, neuromuscular skeletal problems also. Many times some of the skeletal problems may also lead to the abnormal posture. Number two, which is very important for the posture, is adequate muscle power in the muscles of the trunk and lower extremities. Nerve supply is okay, neuronal supply is okay, but there is some localized problem in the muscle itself. Okay, the power of the muscle is reduced either in the trunk area, in the axial area or in the lower extremities, etc. Definitely posture of the child will go into change. So this you have to keep in mind. Postural sensory impulses regarding the position sense. Position or posture also depends upon the sensory impulses. There are so many sensory impulses which are continuously going to the sensory cortex through the sensory nerves in the posterior column of the spinal column. We know that. So one of such sensation is position of sense of position. In which position actually you are now? Because see, while walking, we are continuously changing our position itself, isn't it? So every step that sensory signals go up and correct our position accordingly. So if the sensory signals which are reaching the brain, if they are not proper, or if there is some problem in the sensory roots or sensory nerves, tracts, etc., again posture of the person may going to change. Okay, position sense he is not able to acquire, so therefore posture will going to change. Labyrinthine impulses which is coming from the ear, okay, they also helps to maintain the spatial position in the body and affects the gravity also. So if the problem is there with the ear, okay, otitis in children, maybe chronic otitis media like conditions, okay, posture may going to change because of the affliction of the labyrinthines. Similarly, cerebellar system play a very important role in maintenance of the tone, posture, equilibrium, etc. We know that. So if there is a problem in the cerebellar system, especially the vermis is present in the middle portion, okay, laterally we have got the lobes, vermis, so that plays a very important role in the maintenance of the posture related to axial and truncal muscles in the midline. Okay, similarly cooperation of the higher centers in the cerebellum. Ultimately there may be some problem related to the cerebrum also, because they are the one which are giving the motor impulses, motor output. Okay, so if the output is not good, then the muscle may not be able to maintain the posture. So these are all the the points that you have to look whenever a patient is having abnormal posture, because of all this only the normal posture of the person is possible. So pathology related to all of this may result in abnormal posture. Okay, now coming to the next side, that's the posture. When you view the patient from a side, usually a normal human, the human body in the standing posture always displays either a vertical line or a S-shaped curve. Okay, if you are viewing from this side, a patient, you are viewing him from the side, so mostly it will give a vertical line to you. Okay, so if that vertical line is visible, that means that it's a good posture. And sometime when you are viewing from the side, you are getting a S-shaped curve. So if there's an S-shaped curve is there, so that means the posture is very poor. As kyphosis, scoliosis, and so lordosis, so many conditions are there. So this is one thing. Second one is asthenic posture. What do you mean by asthenic posture? Asthenic posture is actually because of debility. Severe muscle wasting is there. Okay, or senility is there. 80 years, 90 years of old, senility is there. So normal curves of the vertebral columns or spine are get exaggerated, resulting in shrunken chest and protuberant abdomen. So because of the exaggeration, that means improper formation of these curves, the chest portion will become shrunken like this, and because of this abdominal portion get protruded. So this is usually seen in case of wasting, debility, severe cachexia, or even in case of senile conditions. Okay, so there is also drooping of the shoulders. One more important posture which come across is the Parkinsonism posture in adults usually. This is nothing but a stooped position when standing or walking. So standing and walking, he is always inclined forwards because he is trying to catch the center of gravity. It looks like that he is trying to catch the center of gravity. Okay, so to maintain that gravity, that center of gravity, he always be there in the inclined position, stooped position. So what actually happens? Vertebral column, then hips, knees, and ankles are slightly flexed in this condition. And while walking, he is trying to catch the center of gravity. He will always take the small steps, and there will be contraction of the both flexors and extensors. If you look into the pathology, that particular gait is also called as fascinating gait or Parkinsonism gait. Small, short steps he will take. So this is called as Parkinsonism posture. Another important is hemiplegic posture. Hemiplegic posture means we know that because of the hemiplegia. So there will be clear-cut asymmetry. In the right and left side you will find clear-cut asymmetry in hemiplegia. In the affected side, what is the posture attained by the patient? In the affected side, there will be adduction of the shoulder. Shoulder is get adducted. There will be flexion of the elbow, and then pronation and flexion of the wrist, and hyperextension of the lower limbs. In the lower limbs, hyperextension will be there. So this particular position which is attained by the patient clearly indicates it's a hemiplegic posture. Tabatic posture. One more posture is tabatic posture. So this is actually seen in tapes dorsalis or sometime even in pseudoptosis. Usually we will find in tapes dorsalis where wrinkled forehead will be there and unequal pupils will be there, and important posture wise, that is wide separation of the feet. Feet are widely separated. So this is in case of this is called as tabatic posture. Lordotic posture is one more important posture. Yes, this is called as a sway back posture. Okay, so this is due to the muscular origin of the maybe due to muscular origin or neuromuscular origin. If you look into the patients of Duchenne's muscular dystrophy, or Becker's dystrophy, or some other dystrophies, okay, muscular dystrophies, so usually they will obtain this the lordotic position. So that gait, there will be transfer of the weight from the one leg to the another leg will be also seen. So lumbar curvature is mostly exaggerated anteriorly. There is dipping up of the lumbar curvature towards anteriorly will be seen. Same type of posture is also seen in pregnancy, which is quite normal. During the pregnancy, this lordotic posture is normal. Okay. So abnormal lordotic posture is very commonly seen in case of patients of muscular dystrophy. Proximal muscle weakness is there, therefore pelvic will be tilted during each step. One is weight transfer from one leg to another leg. Pelvic is tilted forward with each step. That everything is happening because of the weakness of the proximal muscles. One more is a flexibilitas seria. So this is actually seen in case of schizophrenia. In sometimes the patients of schizophrenia, so what they will do is body limbs tends to maintain the same position for hours together or even days together. Okay, if they are sitting like this, they will keep on sitting in the same position for hours together or even up to days together. So that is called as a flexibilitas seria. Astasia abasia. This is one more thing which is posture which is seen, which is very commonly seen as hysteria. Hysteria is according to the patient's convenience, isn't it? Patient is mimicking it. That means according to his convenience, the patient is creating that situation. So therefore, in this condition, patient is unable to stand. He is not able to stand. But if the patient is lying down in the bed, he is able to move the limbs. So this particular position or posture is called as astasia abasia. Cerebellar attitude. So one more is cerebellar attitude. Now posture and tone, they are greatly dependent on cerebellum. We know that. So if there is any problem in the unilateral cerebellar disease, there is some unilateral cerebellar disease, or even in case of torticollis. Even in case of torticollis, what we get is head is held awkwardly. Head is held awkwardly or obliquely in relation to the body. Okay. In case of torticollis also we will get a typical awkward posture. Even in case of mild cerebellar lesion also, there will be difficulty in standing, and all cerebellar regions you will keep the feet apart, widely spaced feet. Now come to the next part, that is decubitus. So decubitus, as I told earlier, it is told that decubitus is nothing but the posture attained by the patient in the bed. So normal decubitus, we know that how you keep the limbs and arms, etc. Now there is a passive dorsal decubitus is there, where if the fever, for example, if a devastating fever for many times, so the patient is lying in the bed, but he is not able to maintain that bed position, and frequently he fall or slips. Then again he will correct again sleep. So this is in chronic devastating disorders or chronic devastating fevers, etc. Usually we find this particular decubitus, passive dorsal decubitus. Rigid dorsal decubitus is one more thing. So usually in some of the spasticity, etc. conditions, we will find this rigid dorsal decubitus. Now, opisthotonous very common, yes, seen in case of hyperthyroidism, etc., where there is arching backwards. Backward arching will be there. Okay, just like a bow, backward arching will be there. Amphoros or tonus is exactly opposite to that, that is arching forward, which is commonly seen in three conditions. One is tetanus, meningitis-like condition, or strychnine poisoning. Okay, lateral decubitus, that means patient is attaining the lateral position. So this is commonly seen in some of the chest conditions or lung conditions. For example, patient with a pleurisy, dry pleurisy. Okay, if the one side is having dry pleurisy, he may go to the lateral decubitus of the another side. If in the right side there is a problem, he will go for the left side. So respiratory problems, lung parenchymal disorders, emphysema, okay, chronic pneumonias like condition, patient will going to attain a particular posture which is very convenient to him, which causes less discomfort to him. One more type of decubitus we will have is a coiled up decubitus. That means even in case of meningitis, we will see coiled up. All the body is coiled up. Okay, just flexion. Okay, cerebellar disease and even colic abdomen. The patient is having more colic abdomen. For example, renal colic and all those things. So he always keep one decubitus permanently because that is giving relief to him. Even in case of meningitis, he always used to flex the vertebral column or the thighs. That means lower limbs, etc. Because in the flexed condition, what happens? The spinal cord is get relaxed. Okay, when he is flexing, the spinal cord is get relaxed, so there is no stretching. So therefore, he may be having comfort. So therefore, he used to keep the same position. So that is called as coiled up decubitus. Orthopneic posture, yes, orthopneic posture is sitting up posture. The patient is lying down in the bed or in the recommended position. Suddenly, he developed dyspnea. So now to overcome this dyspnea, he get up and sit in a chair. Because in the sitting position, so he will get relief. The reason is very simple. Orthopnea like conditions very common in the cardiac problems, congestive cardiac failure, cardiac problems, etc. So in the sitting down position or in the sleeping position, actually what happens is there will be redistribution of the edema fluid. So pulmonary edema develops. Once the pulmonary edema develops, he will have breathlessness. To relieve from this particular discomfort, patient try to attain the sitting position, because in the sitting position what happens, the fluid which is there, edema fluid, so that will be again displaced downwards due to the gravitation, collect in the dependent most areas, and lung parenchymal, that is parenchymal edema which is developed, so that will be relieved and patient get relief. So now once this is habituated, patient always attain the same position, because in that position he is getting comfort. So that is called as orthopneic posture. Another commonly seen is prayers posture, also called as namaz position. Prayers position where patient may lean forward, either sitting in the bed or in the floor. That means leaning forward and touching the head to the knee condition, knee position. This is also called as knee chest position. This is also called as knee. His chest is now touched to the knee. Okay, so this is very important. Especially in congestive cardiac failure like condition. Okay, so chronic cardiac problems, chronic respiratory problem, core pulmonary like conditions. Okay, so again to overcome the distribution of the fluid, that's the point. Okay, to overcome the discomfort. So that's called as knee chest position. Another position which is commonly in children is squatting position, squatting posture. Squatting position, that means when you are in the Indian style of this, what you say, latrine, so that sitting position. Okay, so they're sitting on the sitting with the hip flexed and knee flexed and putting the pressure on the heels. Okay, so heel portion, just like we are sitting in the Indian style of a latrine. That's called as that is called as a squatting posture. Prayers posture and knee chest position, what I told, there is some difference, a mild mistake I have done. Prayers posture is not exactly the knee chest position. Okay, here there is not that patient is bending forward, that's all, just like a namaz position. Okay, knee chest position is actually nothing but this squatting posture. Okay, make a small correction. Okay, knee chest position is a squatting posture where you are putting all your weight on the heels. Okay, and this is quite convenient for those conditions where cyanotic heart disease. A child with the cyanotic congenital heart disorders, So to overcome that problem again, the child usually attains the squatting posture. Make a small correction. Prayer posture or namaz position is seen in case of a chronic, that means congestive failure like conditions. Okay, this is not knee chest position. Knee chest position is a squatting posture. Okay, so knee chest position. Even the prayer posture can be also seen in some of the devastating disorder like chronic fever and all. After during the recovering phase, usually the patients they used to go for this prayer position. Okay, stooping forward. So this is all about decubitus. So when you are looking at the posture of the child or of the patient, you have to be have a glimpse of all these things in your mind. So these are the possibilities of different types of postures. Thank you very much. In the next class, we'll come up with one more important point in the general examination. Thank you very much.